The proceeding will start shortly. 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 The proceeding will start shortly.
Order. Tonia Antoniazzi to move the motion.
Thank you, Chair, and it is an honour to serve under your chairship. I beg to move that this House has considered E-petition 594390 relating to prescription charges for people aged 60 or over. The petition I'm presented today touches on a number of incredibly important issues in healthcare, from access to treatment to public health and preventative care, all within the context of how the NHS adapts to an ageing population. But despite the focus on prescription charges, this petition must also be considered in the broader economic context. A cost of living crisis with months of rising inflation and rising prices, where even the most basic necessities are becoming luxury items for many. The steady rise since 2015 of pensioner poverty, which shows no sign of stopping, continuing a trajectory that will see many millions of us face a retirement dominated by debt and hardship. And it is this context which means we are duty-bound to look beyond figures on spreadsheets and examine what the proposed scrapping of free prescriptions for this age group really means for those who will be impacted by it. It's those impacts that the petition creator, Peter, had in mind when he set it up. When I spoke to Peter about why he started the petition, he spoke to me about his concern for the impact these changes would have, not on him, but his local community. On the men and women he knew who were already struggling with costs and making difficult choices about what to prioritise. On those like him, who had spent a lifetime working in industry, and those who, because of that work, are now suffering from a variety of medical conditions, each needing different medications. Those women he knew, including his own wife, who had their lives upended by the callous way the government implemented the equalising of the state pension age. And WASPy women, that is, those born in the 1950s and live in England, have further issues to deal with compared to those in devolved countries. I will.
Thank you, Honourable Lady, for giving way. Uprating the age where prescriptions become free in England in line with the state pension age as the government consulted on would be harmful with the current costs, as the Honourable Lady has said, of living crisis and growing economic activity in those over 50 for various reasons, including for many their health. Does the Honourable Member share concern about what this could mean for ease of access to medical treatment for the older generation?
I thank the Honourable Lady for her contribution, and it is indeed a huge concern that people who have multiple health problems are having extra difficulties in accessing prescription charges, making those difficult choices over how they spend their money. Now, for Peter, it seemed that something has gone incredibly wrong to get us to this point, something broader than this planned introduction of charges, but something encapsulated by it. A breaking of a promise a promise between citizen and state, a promise that a lifetime of contribution, whether financial, through tax and national insurance, or through the unpaid labour of care that enables our economy to function, means support in retirement. Now, Peter kept his part of the bargain, and it was great to have a conversation with him. He couldn't believe that his petition was getting debated in this place. And it is so important that his voice and the voices of others are heard in this place. But he kept his part of the bargain, first in the shipyards on the Tyne and then working on aircrafts. He paid in, he did what was expected, as did hundreds of thousands of others. But the government hasn't held up its end of the bargain. It's changed the rules, and it looks to be doing it again. And it's this unfairness that's the reason why we're discussing this today. And this plan to introduce charges seems particularly unfair when Peter doesn't even have to look that far from home to see a better way. England is the only nation in the United Kingdom without free prescriptions. And, as colleagues might have guessed it from my accent, I'm Welsh, and I have the great pleasure of representing Gower, one of the 3 Swansea constituencies, and it's very beautiful as well, so if you ever want to come and visit, please do. But Swansea and Newcastle do have a lot in common. Both port cities with a proud industrial heritage, both famous for an excellent night out also. But it seems the height of unfairness to many in Newcastle and across England that they alone in the UK pay for prescriptions. Now, I'm sure that the government will tell us that several conditions are exempt and that prepayment certificates cut costs down. But as I said earlier, we must look beyond the briefings and at the reality of what this system actually means. Not only is the exemption list woefully out of date, apart from the addition of cancer in 2009, the list has not been reviewed since 1968. It also doesn't cover several life-changing conditions, and I'll list them: Parkinson's, arthritis, asthma, Crohn's disease, cystic fibrosis, lupus, or motor neuron disease. And this is the tip of the iceberg. Those with these and other complex lifelong conditions still pay for their prescriptions, and for those with multiple coexisting conditions, the cost is even higher. Evidence from the Prescription Charges Coalition, a group of 50 organisations calling on the government to scrap prescription charges for people with long-term conditions in England, shows that people with long-term conditions struggle to pay for their medication. A third of respondents in England with long-term conditions had not collected a prescription item due to the cost. Nearly a third admitted that they are skipping or reducing medication doses, with cost concerns a key factor for more than 4 out of 10. As a direct result of reducing or skipping medications, nearly 3 in 5, that's 59%, became more ill, and 34% needed to visit their GP or hospital. In fact, the government's own impact assessments on the introduction of charges highlights this issue and notes the potential effect on people's health. In 2018, thousands of over-the-counter medicines were taken off the list that GPs are able to prescribe people, leaving those with long-term conditions facing additional costs for their conditions and to stay well. And these worrying health outcomes come with a cost to the NHS. Several member organisations of the PCC conducted research last year, and they found that 1 in 6 with asthma and lung disease surveyed had cut back on using their potentially life-saving inhalers as they were worried about the cost. 29% of respondents with cystic fibrosis had skipped the medication due to prescription charges. And 1 in 5 people with MS say they don't have enough money to pay for the medication or treatment they need. One lady who lives with kidney disease was hospitalised twice because she had to wait until payday to collect a prescription. In hospital, she had to have a lumbar puncture, an MRI scan, costing the NHS thousands more. As colleagues can see, the impact is vast, and in meeting with campaigners prior to this debate, I heard far too many stories like this one. The lived reality of those who are impacted by this proposed change and the issues caused by the current dysfunctional exemption system are best understood through this lens. I work closely with Parkinson's UK, who are one of the many organisations deeply concerned with this proposal. Medication is the only way to control Parkinson's symptoms, and most have to take a cocktail of medications to stay well. Research shows that Parkinson's costs households over £19,000 a year in 2021 due to the loss of work and additional health and social care costs. As Parkinson's progresses, it becomes more complex. Among people who are eligible to pay prescriptions aged 60 in any year, 5.5% will die within 5 years and 23.8% will need support to live independently. That's only 5 years within being diagnosed. Yet it could still have to pay for their essential Parkinson's medications. Look, I want to tell you a little bit about Denise. Denise is 59 and was diagnosed with Parkinson's in April 2019. She has had to reduce her working hours from 37.5 hours to only 12 per week due to her symptoms. Denise currently uses a prepayment certificate for her prescriptions because it is cheaper than purchasing them individually. But if the exemption age rises to 66, she will have to continue paying for this. Denise told Parkinson's UK about the impact this would have on her. I've always thought I would work until I was 67 because I was able to. However, as my Parkinson's advances, I worry whether I physically will be able to. And while my employer is really understanding, allowing flexibility to start later in the mornings until my medication is kicked in, but I've had to reduce my hours by 60%, and I'm already noticing the impact of this reduced earning capacity on our household. I have to pay for my prescriptions, and this is eating into the diminishing amount I can contribute towards the household bills. If they were to increase the age at which I would become exempt, it would be really tough because we haven't allowed for more years of these additional charges. She says, it feels like the government is once again penalising those living with a long-term health condition like Parkinson's that anyone could get and for which there is currently no cure. Denise's story isn't an isolated one, and Parkinson's isn't the only condition where sufferers will be further disadvantaged by this change. And this isn't a problem that would be solved by changing the exemptions list. An exemption list has winners and losers baked into its design. And the complexities of managing chronic conditions means any approach that is not universal is not fit for purpose. A question that the government needs to answer is, why is this change being prioritised now? And what evidence is there that it will have any kind of positive impact? Because we can't see it. Even if the government makes savings in the short term, the long-term impacts could be catastrophic, leading to greater illness and more GP and hospital visits. A poll published in Pulse found that 40% of GPs link prescription charges to adverse patient outcomes, also indicating that these can lead to far greater costs and adverse outcomes down the line. And initial results from the Prescription Charges Coalition 2023 survey showed nearly 10% of respondents not collecting medicine due to cost, and of that group, and I've got some more data, 30.74% said they now have other physical health problems in addition to the original health condition. 33.3% said they had to go to my GP. 17.32% said that they had to go into hospital for treatment, and 8.23% said they had to go to A&E. Research published in 2018 by York Health Economic Consortium highlighted how ending prescription charges for long-term conditions could save money and reduce pressure on the NHS. This comes from preventing avoidable health complications that occur when people do not take their medication. The research identified net savings of more than £20 million a year if the NHS scrapped prescription charges for those with Parkinson's and inflammatory bowel disease alone. That the government is instead discussing introducing additional charges flies in the face of common sense. We know the NHS is under pressure, but that's the case across the United Kingdom, and the devolved nations are not even discussing removing universal free prescriptions. So I would urge the government to follow their lead, look to the future, and not engage with short-termist quick fixes that won't be a fix for all, and not even the petition creator. Thank you, Chair.
The question is that this House has considered E-petition 594390 relating to prescription charges for people aged 60 and over. Tonia Antoniazzi.
Sir Edward, it's a pleasure to serve under your chairmanship. And can I start by thanking my honourable friend, the member for Goa, for securing such an important debate. As a cancer pharmacist and as the chair of the all-party parliamentary group for pharmacy, and as somebody who still volunteers at a local hospital, and I was there this morning, I have seen firsthand the difference that it makes for those over the age of 60 for them to have free access to medication when they need it. And for years, I have treated patients who these proposals will make worse off. And I know just how anxious they are at the prospect of having to fork out another monthly expense that they simply cannot afford. Now, when the choice is between heating and eating, which is a day-to-day reality for thousands of people in my city, we cannot sit down idly while health is incorporated into the mix as well. It really should not have to be spelled out that as people age, they will develop long-term healthcare needs, and these needs will need to be treated by prescription drugs. Happy to give way.
For giving way. Prescription charges have been described by pharmacists as a tax on the sick, who have reported a significant increase, as we've heard, in the number of patients not collecting their prescriptions because they simply can't afford the money to spare. Does the honourable member agree this is worrying across all age groups, but would be especially so for over 60s who are more prone to sickness and needing that medical aid?
I do agree, and it's sad to say that we do look at the pharmacy shelves and we see many patients not picking up their prescription, or patients coming into the pharmacy counter and realising how much it costs, and then realising that they can't afford to pay for it because they haven't financially planned for it. And this is something I'll be going on to speak about later on in my speech. Now, the government's own impact assessment concluded that 52% of people between the age of 60 and 64 will have at least one long-term health condition. So by aligning medical exemptions with state pension age, the government is hitting the people in my community who both have the greatest need for medication but simply cannot afford it. So I would just like to ask, what does the government expect to happen when people in their 60s decide that they can no longer afford their prescriptions? Because if saving money is their aim, I question whether they have considered the reality that these proposals will simply shift the costs from primary care to urgent care, where health conditions inevitably worsen and patients are forced into overcrowded A&E units, now adding to the already overwhelmed demands on a health service. I'd just like to also support some of the points highlighted by the member for Goa with regards to long-term health conditions, especially for patients with unchanging health conditions like asthma, motor neuron disease, and sickle cell anemia. As she has highlighted, the York Health Economic Consortium estimated that 20 million would be saved each year if the NHS scrapped prescription charges for people with Parkinson's and inflammatory bowel disease alone. Now, this is all because fewer people will be forced into A&E, meaning fewer hospital admissions and fewer GP visits. Now, prevention is key. If we want to save the NHS money, if we want to reduce the burden on the NHS, prevention is key. And medicines play an essential part in preventing patients' healthcare conditions from worsening, but also preventing patients from developing other healthcare conditions. And it's really concerning that the government can either consider this as an option or as a way of helping to reduce the impact or the burden on the healthcare system. And I'm generally concerned that this is a hugely irresponsible decision for the government to even consider making. It is essential that the government does consider first engaging in some form of cumulative impact assessment on people over the age of 60 for such changes, especially for those with long-term conditions, because they will be disproportionately affected. Now, my older constituents in Coventry North West, they are anxious, they are stressed, and they tell me that they simply do not know what they're going to do to make ends meet at the end of each month, especially when having to deal with the soaring energy bills and food costs. And they ask, why does the government continue to attack elderly residents during the most severe cost of living crisis for a generation? I'm hoping that the government will answer that. And I especially worry that making our ageing population pay for medication will leave huge numbers of people unable to afford essentials and force them into further hardship. Now, finally, I would like to add my support to Prescription Charge Coalition, who are calling for a freeze in prescription charges for 2023, and have said that the government must scrap these plans for alignment. And I recognise the government is planning to support their proposals. But can I just add, as somebody who finds herself every year, especially on the 1st of April, helping patients fill out prepayment cards or helping them navigate the increase in NHS charges, which many of them don't even recognise it's coming up. So firstly, can the government notify patients of the increase way before the 1st of April so patients are able to financially plan? Because for many of them, that means that they won't have access to their medication when they need it. But secondly, can the government actually consider reviewing the long-term exemption list for patients with medical conditions, which we know are not going to change due to the nature of their conditions. Now, and lastly, I do want to make an important point, which is the fact that older people have contributed to our society their whole lives. They have trusted that if they work hard, if they pay their taxes, they will be looked after. That is the deal that we make with them, and that is what they expect from us when they get older. And this proposal will break that trust. And so we simply cannot afford to abandon older people now, simply because the government has decided that this is the best way forward. Because in the long term, that would simply impact trust. Lastly, I just want to add one more thing in, is that can the Minister speak to the primary care Minister to come to the Pharmacy APPG meeting, which is happening on the 29th of March in Room S, PCH, from 1 to 3 p.m. to speak to pharmacists as well, because we will like to continue debates and to talk about some of the current pressures that pharmacy is facing as a whole. But thank you, Sir Edwards, and it's been a pleasure to contribute to this debate, and I look forward to hearing from the rest of my colleagues. Thank you.
Thank you, Sir. It's a pleasure to serve under your chairmanship, and I thank all the previous speakers, and some of what I say will be a repetition, but I don't think in this case repetition is not unwelcome. Under the SNP Scottish Government, prescription charges were abolished in Scotland in 2011. Scotland gets free prescriptions because the Scottish Government believes mitigating illness costs is in the best interest of the population of Scotland. And the SNP has led the way in delivering progressive and forward-thinking public health measures that people across Scotland continue to benefit from. I speak from experience, Sir Edward, as I was honoured to be part of the call for the new generation of cystic fibrosis medications to be released in Scotland, and it was first to get them. And I declare an interest because my granddaughter, Saoirse, will continue to benefit for the rest of her life from these new drugs, and it will extend quite considerably her life expectancy. In all credit to the Scottish Government, inhalers, antibiotics, life-saving medicines such as insulin for diabetes and many others are provided at no cost at all to the patient at any stage. So Scotland receives no extra funding for this decision and doesn't take money from other areas of the United Kingdom to pay for it. England is out of step with the rest of the UK. For more than a decade, NHS prescriptions have been free in Scotland, Wales and Northern Ireland, yet with the Tories in power in England for 13 years, they've not replicated this approach, instead penalising those wishing to collect medicine. And as we have already heard, the cost of living crisis has actually increased the non-collection of prescriptions. When the NHS was founded in 1948, there were no prescription charges, but in the early 50s, fees were introduced to help with funding. Yet Labour's position in 2019 was to roll back charges for England, which appears to be dropped under the present leadership. Unequivocally, the SNP has used the powers we have to ensure that people in Scotland benefit from the most generous social contract in the UK. NHS prescriptions are able to be, the cost is able to be mitigated in England if you use a prescription season ticket, a prepayment card. However, many people in England are still unaware of this system, and at the least, could I ask the Minister if he would tell us how he would be prepared to advertise this more than it is currently done. I think I use the example, Sir Edward, of cystic fibrosis medication, but I think if we look now at HRT, which is the Honourable Member for Cardiff, and I can never remember which part of Cardiff, West, I think. Myself. No, the Honourable Member for Cardiff East has done really good work in this area across a number of years. And it still seems incredible, after the arguments that she has forcefully put forward in this place, that women who are going through the menopause are still having to pay for their HRT. The most recent announcement committed the government to reduce the cost by from April of this year, and they may receive a year's supply of HRT for the cost of 2 single NHS prescription charges in England, whereas in the rest of the UK they get it free. Yet while cost reductions are welcome, charging women who experience menopause, it really does seem obviously inadequate to charge them less. That they should actually get this free, because the amount of work that they can then do will be increased, and then it means it's a benefit to the whole economy. People who have asthma and are afraid sometimes to go and collect their prescriptions, as we've already heard from the Honourable Lady. And a small survey of pharmacists published by the RPS, the Royal Pharmaceutical Society, just last month found that a rising number of patients in England are failing to collect their medicines because they can't afford them. 51% of these pharmacists surveyed reported an increase in patients not collecting their medication, and 67% saw a rise in patients asking if there was a cheaper over-the-counter substitute for the medicine they'd been prescribed. This is appalling in this day and age. And what it does lead to is more hospital admissions, more expensive care required in the longer term. And it really defies common sense that this is actually going to be allowed to continue. In essence, the three devolved governments have taken a preventative approach to mitigate poorer health outcomes by the provision of free medical access to medicines for those who need it, while in England this tax on sickness reduces access to medicines and leads to poorer health, time off work and potentially hospital admissions, offsetting any cost gain from prescription charges. This government should absolutely scrap prescription charges, and to introduce it for people who are still working up now until they're age 67, when, as the Honourable Member behind me actually said, as you get older, you are more likely to need medication. It seems absolutely absurd. The government in the public consultation ominously said anyone aged 60 or older can get free prescriptions for medicine. We're thinking about changing this. The change would mean prescriptions would only be free when people get to pension age, but today's pensioners have no need to worry. Well, they will worry. People worry even more now during this cost of living crisis. Could I ask the Minister, please, is he prepared to go ahead and heed what is happening in other devolved nations in order to equalise medicine access right across the United Kingdom?
Thank you, Sir Edward, and it's a pleasure, as always, to serve under your chairmanship. I'd like to start by thanking the Petitions Committee for facilitating this debate, and indeed to my honourable friend, the member for Gower, for the passionate way that she put forward the arguments of Peter and Denise and many others who find themselves in the predicament of having to pay for prescriptions, or the worry that they might have to pay for prescriptions as pensioners. It's a pleasure to be responding to this debate on behalf of the Shadow Health and Social Care team, but also as a Member of Parliament for Denton and Reddish, where I know that many of my own constituents, Sir Edward, are concerned about this potential policy change. As we've heard, we are in the middle of a cost of living crisis where many people are facing unsustainable rises to their energy and household bills. It's of little surprise that the government's decision to consult on scrapping free NHS prescriptions to the over 60s will have come as a profound concern to many people already struggling to make ends meet. This anxiety has been compounded by characteristic delay from the Department for Health and Social Care. The government first announced the consultation to scrap free NHS prescriptions to the over 60s in July 2021, meaning that there was little or no time for members of this House to sufficiently scrutinise these proposals prior to that year's summer recess. The consultation closed in September of that year, and 2.5 years on, we are still none the wiser about where the government is on this issue. Now, a quick glance at written parliamentary questions shows that many members from across the House have asked the government for clarity, only to receive a boilerplate response that an announcement would be made in due course. I wonder then if the Minister, in his response, can set out precisely when this announcement will be made and why there has been such a delay in the government addressing its own consultation on this issue. This is important, Sir Edward, because the government's own impact assessment raises several potential problems with the proposals, notably that, and I quote, some people on the lower end of the income distribution may struggle to afford all their prescriptions, which can result in future health problems for the individual and a subsequent cost on the NHS. And that is precisely the point that my honourable friends, the members for Gower and for Coventry North West, and indeed the honourable lady, the member for Rutherglen and Hamilton West, who's now not in her place, made in interventions. We therefore do need to know, if the government does decide to opt for this policy, what steps it will be taking to support people, especially those over 60 and with long-term conditions, with their prescription fees. Now, prescription charges have already increased by 30% since 2010, and given the financial context that we are now in, there are valid concerns, really valid concerns, about the possibility of people being priced out of accessing vital medicines. The Royal Pharmaceutical Society recently conducted a survey of 269 pharmacies, with half of respondents saying that patients were asking them which medicines they could do without. Half of pharmacies surveyed also said that they have seen a rise in people not collecting all their prescriptions at all. And that, to me, is incredibly concerning. Yeah. Last year, Asthma and Lung UK found that 15% of surveyed people with respiratory conditions were rationing the use of their inhalers to make them last longer. 5% of people said they were being forced to borrow medicine from others, something that really frightens me, because your prescription is pertinent to you and you alone. And I hoped we'd moved away from a world where we lend medicines to others. Now, these statistics, frankly, should be causing alarm bells to ring in the Department for Health and Social Care, and, for that matter, in the Department for Work and Pensions. But unfortunately, we've had radio silence. Now, I'd like to impress on the Minister the simple fact that if people are not taking vital medication, they could be living in extreme pain. And in some cases, they will be at risk of serious medical complications as well. So I'd like to ask the Minister, has he and his officials made any assessment of the number of people in England who are currently unable to afford medicine and the knock-on impact that this is having on NHS services, which are already at breaking point, thanks to this government's mismanagement of the NHS? Now, we know that last year the government froze prescription charges in a move that was very welcome to many people here in England. The next review is due to take effect in April, and I'm sure I don't need to remind the Minister that this will come at the same time as the implementation of Ofgem's new energy price cap. So can the Minister provide an update on this review and whether he anticipates another rise in the cost of prescription charges, or whether the government will do the right thing and freeze them again for another year? And while he's at it, perhaps he could also nudge his colleagues in the Treasury to do the decent thing and to implement a proper windfall tax on energy and gas giants to extend energy support so that those on the lowest incomes are given protection against astronomical price rises. Because in the 21st century, here in the United Kingdom, Sir Edward, no one should be forced into making the choice between accessing vital medication or heating their home or feeding their family. The final point I wish to make, Sir Edward, is one that's connected to this issue, and that is that the government seems to have no vision or appetite to prioritise preventative public health. In the context of an ageing population, it's important that we build healthier communities. This is not only morally important, but practically too, especially if we want to reduce reliance on prescriptions and on primary care. So what steps is the Minister taking to prioritise preventative health going forwards? And on that note, can he set out why the public health grant allocation has still not been announced for local authorities in England? Many local authorities who have already set their budgets still don't know what their public health grant allocation is in 3.5 weeks' time. The next Labour government, Sir Edward, will give the NHS the tools, the staff and technology it needs to treat patients on time and put prevention right at the heart of everything it does. But coming back to the issue before the House today, I really hope that the government understands the concern, the worry and the anxiety of those over 60 in England who are concerned that their free prescriptions may well be coming to an end. I want to mention my right honourable friend, the member for Wentworth and Dearne, who was here at the start of proceedings. As a member of the Shadow Cabinet, he can't take part in these deliberations, but he wanted me to highlight some of the work that he has been doing in his constituency with his local team, collecting signatures against the proposed scrapping of prescriptions for the over 60s. And he can tell his story 650 times over to the Minister, because there are elderly people across England who are concerned about this and want answers from ministers, want their concerns heeding, but also want assurances from this government that they do get the reason why prescriptions have been free for the over 60s, want the government to understand why it's important that that remains the case for the future, and to understand that the government is on their side when it comes to this issue, and that their free prescriptions aren't at risk, and we don't put people who can't afford their medication into the dilemma of whether they heat their homes, feed their families, or get the medication that they so desperately need. Britain's better than that, and I hope the Minister has some positive news for us.
Yeah.
Minister.
Thank you, Sir Edward. I'm very grateful to the Honourable Member for Gower for opening the debate so effectively on behalf of the Petitions Committee, and I'd also like to thank all the other members for their constructive contributions to this debate. And could I also thank the 46,000 members of the public who signed this E-petition. The government provided its initial response to the E-petition in January 2022, and I'm pleased to be able to respond again today, having listened to the very important and interesting contributions from many members during this debate. The context, of course, is the Russian invasion of Ukraine, the high energy prices, inflation and cost of living pressures that it has unleashed, and it's worth situating it in the context of some of the things we are doing to take action on that. Some of these have been things that honourable members have already referred to. This winter we're spending a total of £55 billion to help households and businesses with their energy bills, one of the largest support packages in Europe. A typical household will save about £900 this winter through the energy price guarantee, in addition to £400 through the energy bill support scheme for households. We're also spending £9.3 billion over the next 5 years on energy efficiency and clean heat, making homes cheaper to heat. And some of this is being paid for by the windfall tax at 75% rate. It's one of the highest of any of the countries around the North Sea. And that's enabling us to do more on the cost of living, like the £900 cost of living payment for 8 million poorer households, and also the other measures we're taking, like the largest ever increase to the national living wage, helping 2 million workers, and the £26 billion that we are spending in total on the cost of living support next year. Now, turning specifically to the question of prescription exemptions, I should start by trying to manage some expectations about what I can say today, for reasons I'll elaborate on. It's clear that the outcome of the consultation on aligning the upper age exemption on prescription charges with the state pension age is very important to many members' constituents. However, I can only say at this point that no decision has been made yet to bring proposals forward. We received over 117,000 responses to the consultation, a testament to the strength of feeling on the issue. And we want to ensure that everyone across the country can afford their prescriptions, especially those who are being affected by the cost of living pressures caused by the Russian invasion. And that's why we've thought long and hard on how best to balance the needs of those in the affected age group, whom we know many will be finding they have additional health needs compared to when they were younger, with the pressures facing the public finances. I can, however, assure members that we will be responding to the consultation in due course. And our honourable members will be aware that the petition called on the government to protect free NHS prescriptions for all over 60s. We value our older members of society, and we recognise their social care and health needs. On the one hand, we recognise that families up and down the country are facing unprecedented pressures on the cost of living. On the other, we have to recognise that in light of the COVID pandemic, which has tested the NHS like never before, and the challenging economic landscape, we must ensure that public sector spending represents the best value for money for the taxpayer. And as we look to the future in a post-pandemic world, there's no shortage of challenges ahead of us: an ageing population, increasing people with multiple health conditions, and deep-rooted inequalities in health outcomes that we're tackling. This is all in addition to the challenges of the pandemic and the elective backlog. Now, charges have been around in the NHS for over 70 years, and prescription charges provide a valuable source of income for the NHS, contributing £652 million in 2021-22. And that funding, which is significant, helps maintain vital services for patients, and it's particularly important given the increasing demands on the NHS. And it's for those reasons that we consulted on aligning the upper age exemption from prescription charges with the state pension age. Historically, the initial exemption age for prescriptions was for people aged 65 and over. This exemption was then extended to women aged 60 and over in 1974, and in 1995 to men aged 60 and over, based on the state pension age for women at that time. The state pension age has subsequently increased to 66 for both men and women, with legislation already in place to increase it to 67 and then 68 in future years. The government has abolished the default retirement age, meaning that most people can continue to work for as long as they want to or are able to. This means that many people in the age range 60 to 65 are and can remain in employment and be economically active and more able to meet the cost of their prescriptions. More than half of people aged between 60 and 65 are economically active now, with a further 20% receiving private pension or some other income. As increasing numbers of people live longer, work longer and so on, there are more people claiming free prescriptions on the basis of their age. Indeed, by 2066, there will be a further 8.6 million projected UK residents aged 65 and over, which would be about a quarter of the total population. And it's important to know that over 1.1 billion prescription items are dispensed in the community each year, with 9 out of 10 of these items already, 9 out of 10, currently dispensed free of charge. And the exemptions that allow that may be based on the patient's age, certain medical conditions, or income-based. Now, our estimates are that if we were to make this change, around 85% of 60 to 65-year-olds would be minimally affected by the proposed change. As I've just noted, more than half of them are in employment. About 20% of them also are retired with a private pension and have a higher income, while others would continue to qualify for prescriptions on the basis of their particular conditions. It's also worth noting that there are also extensive arrangements in place to help those who are most in need of support with prescription charges that go beyond those. People who are on a low income but don't qualify on the basis of an automatic exemption like being on UC can also get help through the NHS Low Income Scheme, which provides either full or partial help with health costs on an income-related basis. Anyone can apply for the scheme if they or their partner, or jointly as a couple, don't have savings and investments or property totalling more than £16,000, not including the place where they live. A person will qualify for full help with health costs, which includes free NHS prescriptions, if their income is less than or equal to their requirements. And to support those who do not qualify for one of the many other reasons, either their age or their condition or the NHS Low Income Scheme, there is then also the prepayment prescription certificates that have been mentioned earlier on in the debate, available to help those who need frequent prescriptions to reduce the cost. The prescription charge is currently £9.35, a 3-month PPC is £30.25, and an annual 12-month certificate is £108.10, so just over £2 a week. PPCs can offer significant savings, and an annual PPC can also be paid for in 10 direct debit payments to allow people to save, to spread the cost over the cost of the year.
Will the Minister give way?
I'm happy to give way.
I'm very grateful to the Minister for giving way. I'm a little bit concerned about the tone of what he's communicating to the House, in that he seems to be accepting that there will be a change on the prescriptions for pensioners. But does he acknowledge that with, for example, pension credit, there is a challenge there where a large number of pensioners who are eligible for pension credit do not apply for it because they are fearful of the means test? What's he going to do to ensure that doesn't happen when it comes to prescriptions as well?
Well, perhaps I can set the honourable members' mind at ease. I did say earlier on in my speech that no decision had been made, and I can reiterate that now. I've talked about the different and consecutive different measures that cause people to either be exempt from or to have their cost cut off prescriptions. and now I've been talking about the PPCs as a final step, which can then reduce the cost of prescriptions for those who do pay them. Now, in this debate, it's been mentioned several times that there has been the abolition of prescription charges entirely in the devolved administrations. Health costs is a devolved matter. It's worth noting that spending in Scotland for every equivalent pound in England is £1.25 and it's £1.20 in Wales. So there is that additional budget, and that those devolved administrations with record increases in their spending settlements have full discretion about how they choose to spend them. I know that several members have asked me quite specific questions about the outcome of the consultation. I can only reiterate that we've continued to consider long and hard the many responses we received. We're trying to balance the cost of living pressures on the one hand with a need for increasing funding for the NHS on the others, and we will respond to the petition in due course. I thank honourable members for their contributions today.
Tonia Antoniazzi to sum up.
Thank you, Sir Edward, and I thank members for participating in this debate and the response from the Minister. I'm sure that the people that I met with won't feel that they are reassured by the Minister's response this afternoon, but however, you know, it is difficult, and with no decision having been made about this, you know, the prescription charges being reduced or not, you know, it needs to be done, and the Minister needs to confirm this. And I do feel for the many women mostly, but the unpaid carers that have to look after whether it's children or partners, and the impact that this has on them. People do see it as unfair if it does happen, and the system is not perfect. So we do hope that changes will come. So I thank you for that. Thank you, Sir Edward.
The question is that this House has considered E-petition 594390 relating to prescription charges for people over 60. As many of their opinions say aye. Of the contrary, no. I think the ayes have it. Order the sitting stands adjourned. Thank you very much.
The proceeding has ended. 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 The proceeding has ended.